And BNC's Brittany Jones joins us now to take a closer look at how President Trump's SCOTUS pick could have an impact on people of color who are insured under the Affordable Health Care Act. Brittany, this could have several impacts, isn't that right?
Yes, Laverne, I spoke to a political science professor today, and he says the law has brought black people the coverage they've needed, from an increase of health care coverage to jobs in the healthcare industry. Black people have reportedly higher uninsured rates than white and Asian people. And with Trump's Supreme Court justice pick, it's a strong possibility many black people could lose much needed coverage.
For about 10 years, the Affordable Care Act, also known as Obamacare, has provided insurance to more than 20 million in need, especially for black people.
The implications are huge. You know, the Affordable Care Act was a major piece of legislation, especially for African Americans. It essentially cut the percentage of African Americans who were uninsured. It cut it by a third.
Last year, the Center on Budget and Policy Priorities reported of those 20 million, the uninsured rate fell dramatically for black people in 2010 by about 20% when the law went into effect, and it dropped to just over 10% in 2017. But with Judge Amy Coney Barrett as President Trump's pick as Ruth Bader Ginsburg's replacement on the Supreme Court, the law could potentially be repealed. This as oral arguments are already scheduled just after elections by a coalition of Republican state attorneys generals and the Trump administration, who argue the law's individual mandate is unconstitutional.
I think she's going to be a great justice for many years to come. But I can say they also bring up health care. I mean, Obamacare is terrible. It doesn't work. We've made the best of it. We got rid of the individual mandate, which is great. We are going to protect people with pre-existing conditions 100%.
But Dr. Jonathan Collins, political science professor at Brown University, says there's a wide range of impacts that could come from this. Job loss for black people working in the healthcare industry, a higher mortality rate, and a significant number of black people will become uninsured.
It had a huge impact on getting more and more African Americans under health insurance coverage. What this new nominee essentially creates the conditions to do is undermine that and increase that uninsured rate to where, a lot of folks could not only be going without health care, but emergency health care. We're talking about, fatal incidents that could happen due to the stroke of God that we wouldn't necessarily have the right to the most quality protection.
ACA provided people with pre-existing conditions with insurance coverage, opened the door to free pre-screenings and colonoscopies and mammograms, and it allowed parents to carry their children until age 26. Plus, it lowered premium costs for low-income Americans.
It's no mystery about what's happening here. President Trump is trying to throw out the Affordable Care Act, and he's been trying to do it for the last 4 years. The Republican Party has been trying to eliminate it for a decade. Twice already, the Supreme Court has upheld that law.
And Dr. Collins says younger black people will likely take a huge hit.
So now you have a lot of young adults who are struggling to find jobs in a very turbulent economy, and now they're going to figure out how they're going to have to find healthcare coverage as well. And it's just it's tough to look at a lot of young black Americans in particular and sell them the promise of a brighter future if this happens.
Now, the Affordable Care Act has also served as a safety net for the millions of Americans who lost their jobs and their health insurance during the pandemic. The arguments on the measure begin on November 10th. Laverne?
All right. Thanks, Brittany. We appreciate that report.